Breast cancer is one of the most common types of cancer worldwide. According to the World Health Organization, around 2.3 million people were diagnosed with breast cancer in 2022 alone. It affects both women and rarely men, and early detection can make a life-saving difference. So in this video, we'll break down what breast cancer is, its types and stages, signs and symptoms, how it's diagnosed, and the different treatment options that are available. Breast cancer starts when cells in the breast begin to grow out of control. Like other cancers, these abnormal cells can multiply quickly and form a tumor, which is a lump of tissue that can either be benign or malignant. In malignant cases, the cancer can invade nearby tissues and even spread to other parts of the body through the lymphatic system or blood, which is a process known as metastasis. Breast cancer isn't just one disease. There are many types and even more subtypes. Knowing the exact kind helps doctors choose the most effective treatment with the least side effects. Let's start with the main types. Invasive ductal carcinoma, or ITC, is the most common type. It starts in the milk ducts and spreads into nearby breast tissue. Lobular breast carcinoma begins in the lobules, the glands that produce milk, and can also spread to surrounding tissue. There's also ductal carcinoma in situ, or DCIS. It starts in the ducts but hasn't spread. This is considered non-invasive. Now for the less common types, triple-negative breast cancer is more aggressive. It grows and spreads faster and doesn't respond to hormone or HER2-targeted treatments. Inflammatory breast cancer is rare and fast-growing. It often looks like a rash or redness on the breast. Paget's disease of the breast is another rare type. It mainly affects the skin of the nipple and can look like eczema or irritation. Now let's talk subtypes based on something called receptor status. Receptors are protein molecules on the surface of breast cells. They can latch onto hormones like estrogen and progesterone, and that can help cancer cells grow. Doctors test for these receptors to guide treatment. If the cancer cells have estrogen receptors, it's called ER positive. If they have progesterone receptors, it's PR positive. If both are present, it's HR positive, short for hormone receptor positive. If neither is present, it's HR negative, meaning hormone therapy won't help. Some cancers have too much of protein called HER2, which helps cancer cells to grow. These are HER2 positive. About 15 to 20% of all breast cancers are HER2 positive. Breast cancer is classified into stages, from stage 0 to stage 4, depending on how far it has spread. Stage 0 is non-invasive. Cancer cells are confined to the ducts. This is like DCIS. Stage 1 means the cancer is small and localized. In stage 2, the tumor is slightly larger or has reached nearby lymph nodes. Stage 3 is more advanced, spread to multiple lymph nodes or surrounding breast tissue. And stage 4 is metastatic. The cancer has spread to distant organs like the bones, lungs, or liver. Doctors also use something called the TNM system to describe cancer. T describes the size or area of the cancer. N tells us whether cancer has spread to lymph nodes. And M means metastasis, whether the cancer has spread to a different part of the body. This system helps guide decisions about treatment. Early breast cancer often has no symptoms, which is why regular screening is so important. But when symptoms appear, they may include a lump in the breast or underarm, swelling or thickening of part of the breast, dimpling or puckering of the skin, redness, fleckiness or irritation of the nipple discharge other than the breast milk, and changes in the breast size or shape. If you notice any of these changes, it's important to talk to a doctor. Diagnosing breast cancer usually begins with a clinical breast exam, followed by imaging tests. Mammograms are the most common. They are X-rays of the breast that help spot abnormalities. Ultrasound may be used to check if a lump is solid or fluid-filled. In some cases, MRI gives a more detailed picture of the breast. If a suspicious area is found, a biopsy is done. That means taking a small tissue sample and checking it under a microscope to confirm if it's cancer. Doctors may also test the biopsy sample for hormone receptors or HER2 to determine the cancer subtype. Breast cancer treatment usually starts with surgery, and the type of surgery depends on the stage of cancer, tumor size, location, and personal preference. The two main types of breast cancer surgery are lumpectomy and mastectomy. Lumpectomy, also called breast conserving surgery, removes the tumor along with a small margin of healthy tissue around it. This allows most of the breast to remain intact. A mastectomy involves removing the entire breast. There are different types of mastectomy based on how much skin or nipple is preserved. A simple mastectomy removes the whole breast, including nipple and the skin. Skin-sparing mastectomy keeps most of the breast skin. Nipple and skin-sparing mastectomy preserve both the nipple and the skin. Skin-reducing mastectomy removes excess skin and reshapes the breast area, which is usually done if a reconstruction is planned. After a mastectomy, some people choose breast reconstruction to rebuild the shape of the breast. This can be done using implants, tissues from other parts of the body like skin or muscle, or a combination of both. This reconstruction can happen during the mastectomy or in a later surgery. Another key part of breast surgery involves checking the lymph nodes. This is important because breast cancer often spreads there first. If imaging or biopsy shows cancer in the lymph nodes, surgeons may remove them through a procedure called axillary lymph node dissection. If not, a sentinel lymph node biopsy is performed to test the first draining node from the tumor. Surgery is often followed or preceded by additional treatments depending on the cancer stage, receptor status, and other factors. Radiation therapy uses high energy rays to kill cancer cells. It's usually given after a lumpectomy to target any remaining cancer. It may also be used after mastectomy, especially in cases with larger tumors or lymph node involvement. Chemotherapy uses strong drugs to kill rapidly dividing cancer cells. It may be given before surgery, called neoadjuvant chemotherapy, to shrink the tumor, or after surgery, known as adjuvant chemotherapy, to reduce the risk of recurrence. Hormone therapy is used if cancer is hormone receptor positive, meaning it grows in response to estrogen or progesterone. These treatments block or lower hormone levels to slow the cancer growth. Targeted therapy works by attacking specific proteins or genes that help cancer cells grow, like HER2 positive breast cancers, which have too much of the HER2 protein on their surface. Finally, immunotherapy helps your immune system recognize and attack cancer cells. It's mainly used for triple negative breast cancer, which lacks hormone and HER2 receptors and tends to be more aggressive. Breast cancer survival rates vary based on several factors, including whether the cancer is invasive or non-invasive, the cancer type, and the stage at diagnosis. According to US National Cancer Institute, overall 91% of people with breast cancer were still alive 5 years after diagnosis. The institute categorizes survival based on how far the cancer has spread. Local means the cancer hasn't spread outside the breast. The 5-year survival rate is 99%. Regional means it has spread to nearby lymph nodes and tissue. The 5-year survival rate is 86%. Distant means the cancer has reached far areas like the liver or lungs. The 5-year survival rate is 30%. As a reminder, these are statistical estimates based on large groups. Everyone's situation is different. If you have questions about your specific case, always consult your healthcare provider. Today, more people are being diagnosed with early stage breast cancer. That means it's found when it's easier to treat. As a result, fewer people are dying of breast cancer. In fact, 99% of people with early stage breast cancer were alive 5 years after diagnosis. Some may even be considered cured. But breast cancer can return. When it does, it may come back as metastatic breast cancer, which means it has spread to other parts of the body. Outcomes can also differ by race. According to the American Cancer Society, black women are slightly less likely to get breast cancer than white women, but they are more likely to die from it. You may not be able to prevent breast cancer entirely, but you can take steps to lower your risk. Just as important, early detection helps catch cancer when it's easier to treat. There is no guaranteed way to avoid breast cancer, but the American Cancer Society recommends the following lifestyle steps. Maintain a healthy weight. Ask your healthcare provider for guidance on managing weight safely. Eat a healthy diet, one rich in fruits, vegetables, lean protein, and calcium rich foods. Try to avoid red and processed meats. Exercise regularly. Physical activity is linked to lower breast cancer risk. And limit alcohol intake. Research shows a clear connection between alcohol and breast cancer. Get screened. Mammograms can detect tumors when they're too small to feel. And do regular self exams. Knowing your body helps you notice changes early. Some people have a higher risk due to inherited genetic mutations or family history. If this applies to you, consider genetic testing, medications that reduce risk, preventive mastectomy, and more frequent screenings and physical exams. Always speak with your healthcare provider about your personal risk and what preventive steps may be right for you. Breast cancer is serious, but thanks to early detection, research, and personalized treatment, millions of people are living longer, healthier lives after diagnosis. Regular checkups, self-awareness, and screening can make all the difference. If you find this video helpful, share it to help spread awareness. And don't forget to subscribe for more videos like these.